Good day, folks. Alfie Vente here once again at Vente Pain Relief Clinic and VPRC.ca. I'm hoping you're having a great day. Typically on LinkedIn, I do clinical tip and trick videos. Today, I have decided to do a case study, a soft tissue case study video. This is the first part. There's going to be a second part with the answers and discussion later on. Later on, as in like in a couple of weeks or so. These cases are based on actual treatments that I have given over my 23 plus years as a massage therapist. So if you're a massage therapist, if you're a chiropractor, physiotherapist, physical therapist, or any sort of therapist that focuses on the muscles and the fascia, this might be a video that you might want to watch. I invite you actually to join. At the end, there's going to be some questions. I do suggest maybe writing things down with a pen and paper so you can take down some of the questions in the notes. By the way, if you like our stuff, please like, share, subscribe, and also if you're on YouTube, ring that notification, click that notification bell. All right, so this is called soft tissue case study. Baseball pitcher has, in quotation marks, and this is important, wrist pain. So we will go on to the case. An 18-year-old male patient client walks into your treatment room complaining of right wrist pain. This pain is dull and low grade to mid grade in degree. It is constant and has been chronic for a couple of months. There is zero swelling, or any signs of inflammation to the area of complaint. Other than the pain, this person is not noticing any swelling, any redness, any other thing other than the soreness and the pain that they're feeling. They have seen their MD and have been to different specialists. They suspect carpal tunnel, but Western methods of testing show negative. So at times you will get that where they give the best guess possible, even though the testing is showing negative. They are also negative for any traumatic types of injury above the joint, so the shoulder, elbow, and neck. I also should include the fingers, and there's no traumatic injuries to those areas. You assess the elbow and forearm. Relative to the unaffected side, there is slightly more tightness. So it's not like it's very significant, but you do notice that there's a bit more tightness on that one side. You investigate further, and the patient client mentions to you that he is an elite level baseball pitcher that plays for both his high school and also for a traveling team that travels to different cities for tournaments every few weeks. So being elite, there's a lot of practicing, maybe 2 days. So there's a lot of arm use. So that's a big clue for you. He has noticed that his velocity has dropped a little and that at times raising his arm proves somewhat difficult. It feels weak. This is the right side. So now let's take a look at the key observations. The key observations include right shoulder is rounded more forward relative to the left. Palpation of wrist and forearm show minimal pain and discomfort of the right side. So when you're kind of feeling around the wrist, you're feeling around the hand, you're feeling around the forearm, there isn't really much in terms of actual pain elicited when you're palpating around the area. There is some tightness of pectorals and scalenes. Although active elevation is pain-free and looks relatively smooth and within range, the patient mentions that the right side feels weak. On resisted testing of elevation, there's some weakness of the right side. So you notice that when they're lifting their arm, that there is some weakness relative to the left side. So just to make sure you've got your bases covered, you also do the thoracic outlet special test, and it shows negative. The neuro test and carpal tunnel tests are also negative. So these are your key observations for this case study. The critical thinking questions that I have for you, so this goes back to what I mentioned about the pen and paper. You could write these down. Number 1, is the wrist and forearm the root or just a symptomatic location? It seems pretty obvious from the case study, but just in case, I just wanted to throw that in there. Number 2, what structures would you suspect might be causing this issue? Now, I want you to list in order of importance 3 structures that you could potentially treat. So this is in order, whatever. It could be a muscle, ligament, so on and so forth, but you will list the structures in order. Number 3, what is your theory as to how you came about to your conclusion? So think about your process in terms of like why you think it's that, or the reasoning. Think about the reasoning for why you got to that conclusion. Write it down. So those are those 3 critical thinking questions. Finally, there's an answer and discussion video coming September 12th on LinkedIn, or earlier on YouTube on September the 5th. Thank you for watching. Please again like, share, and subscribe. And if you're on YouTube, ring that notification bell. My name again is Alfie Vente of Vente Pain Relief Clinic and VPRC.ca. We hope to see you in the next video with the answers and discussion. Have yourself a great day and take care of yourself.